How many of you have seen homeless people on the side of the road either talking to themselves or acting out of the ordinary? Most of the time, they're not what you assume them to be. They're either mentally unstable or mentally ill. I'm talking to you about this today because I myself have a family member who is mentally ill. He wakes up every morning hating the person that he is and hating the person that's inside his head. He has tried numerous times to get checked into the hospital, in which they either deny him or give him medication and return him back into society. So why do we need reformed mental asylums? It's important to bring back reformed mental asylums, not only for our benefit, but as well as the benefit of mentally ill people. So if we were to bring them back, it would reduce homelessness, it would reduce the crime rate, reduce overpopulation in state prisons, but it would also benefit the patient as well. It'd give them shelter, medication, so on and so forth. So first and foremost, let's begin discussing how mentally ill patients return back into society after the discharge of over 450,000 patients, as well as why it's important to bring back mental hospitals. So after the release of over 450,000 patients, many of them became homeless. They ended up living under bridges, living in abandoned homes, living behind buildings, or even ended in death. The reason why they ended in death was because of the lack of resources, the lack of medication, the lack of assistance that they needed. So as stated by Kimberly Armando, about 200,000 of those who suffer from schizophrenia or bipolar disorder are homeless. So it not only affected homelessness, but as well as the crime rate. When more people became homeless, the crime rate shot up. So, as also stated by Kimberly Armando, since 1976, there have been 20 mass murders a year on average. Jay Reed, PhD, is a forensic psychologist who studied them. He found that mass murders suffer from schizophrenia to paranoid disorder. They have paranoid narcissistic traits of personality disorders. So, not only did the crime rate shoot up, but as well as the overpopulation in state prisons. So when a person that is mentally ill is sent to prison, they usually have a lot of medication that they are on, but that medication needs to be ran through a doctor. So when the doctor gets these orders, the doctor can take up to weeks to months to even years when placing that order. So the mentally ill patient doesn't get the proper care and treatment that they need. They can either put in a sick call slip, 7219. It just depends on how the prison system is set up. My mom personally, she works at Donovan State Prison in San Diego, California. She's actually a nurse there. She gives the narcotics and medications to the inmates. But not only that, but she also does suicide watches. So suicide watches are basically where a nurse and a CO sit in on where the inmate is sitting there and is stripped of all their belongings. And the nurse and CO have to watch them for hours on end. Sometimes the inmates try to commit suicide while they're being watched, or commit them later if they are not successful in the time. But then again, they're still not getting the proper treatment that they need. So as you can see, bringing back reformed mental institutions would lower homelessness throughout major cities. It also keep mentally ill patients less likely to commit major crimes if kept in mental hospitals. Overpopulation is not only a big deal in California state prisons, but as well as nationwide. If a crime is committed and a jury finds the defendant guilty with severe mental illness, they can later be placed in a mental asylum. So next, let's discuss the reasons why we need to resolve our needs. It's important to resolve our needs because the mentally ill patient needs to get the proper treatment, and when they don't get the proper treatment, it affects them mentally, it affects them physically, and affects how they view themselves in society. So as stated by Leslie J. Scallett, data suggests that people are still being hospitalized for mental health treatment at the same rates, but the nature of the hospitalization is changing to focus more on treating and releasing patients rather than becoming a resident. So like I discussed earlier, my cousin did try to admit himself into the hospital numerous times, but hospitals are trying to medicate you and release you back into society. Most people don't feel like they're fit for society, so rather be in reformed mental asylums. But hospitals don't want you to become a resident, and that's with the majority of their patients. Another big factor that she discussed is studies on homelessness tend to focus on the generic problems rooted in poverty faced by all homeless people and shared by those who are mentally ill rather than the issues specific to any homeless population. So basically this begs the question, if you want less overpopulation in prisons, sending the mentally ill to reformed asylums will best accompany their needs. If you want homelessness to decrease in major cities, make reformed mental asylums accessible. If you want the crime rate to drop, focus on addressing the bigger picture. And finally, if you want all three, focus on the laws and bills being passed in which they affect the situation. So you do need to focus on what's occurring. And now that you've been exposed to more in-depth reasons on why reformed mental institutions are needed back into the U.S., it's important to ask the following questions. Do you want to reduce homelessness? Do you want to reduce the crime rate? Do you want to reduce overpopulation in state prisons? And do you want all three of these to occur? And if you do want all three of these to occur, you need to focus more on the bills, the laws. You need to have a bigger understanding of what's occurring with mentally ill patients. So in conclusion, taking the little step of just making yourself aware of what mental illness is and how we can change their well-being and where they would like their placement, just being more aware, just speaking out about mental illness and what they want more than just forcing medication down their throat would make all the difference. So reformed mental asylums should return back into the U.S. in a proper way.